Have you ever wondered about the common problems that occur with urethral catheters? Well, urethral catheters, often just called catheters, are thin, flexible tubes used to drain urine from the bladder. They're inserted into the body through the urethra. That's the tube that carries urine out of your body from your bladder. Catheters serve a critical role in the medical field. They're used in a variety of situations, like when a person is unable to urinate on their own due to illness or injury, during and after certain types of surgeries, or for accurate measurement of urine output in critically ill patients. But it's not all smooth sailing. Using a catheter comes with its own set of challenges and potential complications. From blockages to infections to dislodgement, there are a myriad of issues that can arise. Understanding urethral catheters is the first step to tackling the problems that come with them. And that's precisely what we're going to do today, so let's dive in. One of the common issues with urethral catheters is blockage. Now, catheter blockage is not a minor issue to be brushed under the rug. It's a serious problem that can have significant implications for the patient. The causes of this blockage are typically twofold: urinary sediment and blood clots. Let's delve a little deeper into each. Urinary sediment is a common culprit. These are tiny particles that can accumulate in the urine, and over time, they can form a blockage in the catheter. Now, think of a river flowing smoothly and suddenly, there's a dam blocking its path. That's exactly what happens when urinary sediment builds up in the catheter. The urine flow is obstructed, leading to discomfort and potential complications for the patient. The second major cause of catheter blockage is blood clots. These occur when blood cells stick together and form clumps. When these clumps get stuck in the catheter, they can block the urine flow, just like urinary sediment. Now, you might be thinking, well, what's the big deal? It's just a little discomfort, right? Well, not quite. Catheter blockage can lead to a host of problems, including urinary retention, bladder overdistension, and even kidney damage. Urinary retention can cause discomfort and pain, and if left untreated, it can lead to more serious complications like urinary tract infections and damage to the kidneys. Bladder overdistension, on the other hand, is when the bladder is stretched beyond its normal capacity due to the buildup of urine. This can cause pain and discomfort, and in severe cases, it can even damage the bladder walls. Lastly, kidney damage can occur if the blockage is not addressed promptly. The kidneys play a crucial role in filtering waste products from the blood. If they are not functioning properly due to a blockage, it can lead to serious health issues. The good news is catheter blockage is manageable. Let's learn how. To manage catheter blockage, we can follow these steps. Firstly, a crucial point to remember is that prevention is always better than a cure. Regular maintenance of the catheter is vital to prevent blockages from occurring. This includes daily cleaning of the catheter and the area around it with warm, soapy water and thoroughly drying it afterwards. It's equally important to ensure that the catheter bag is kept below bladder level at all times to prevent urine from flowing back into the bladder, which can cause blockages. However, if a blockage does occur, it should be addressed promptly to prevent complications. The first step is to identify the blockage. This could be signaled by discomfort, a decrease in the volume of urine, or a change in urine color. If a blockage is suspected, medical professionals should be contacted immediately. Healthcare professionals play an integral role in resolving catheter blockages. They may use a number of techniques to clear the blockage, including flushing the catheter with a special solution or using a device to physically remove the blockage. In some cases, it may be necessary to replace the catheter entirely. Remember, trying to unblock a catheter without professional guidance can lead to further complications, such as urinary tract infections, bladder damage, or even kidney failure. Therefore, it is crucial to seek professional help when dealing with a catheter blockage. In addition to this, maintaining a high fluid intake can help prevent blockages. Drinking around 2 to 3 liters of fluid per day, unless advised otherwise by a healthcare professional, can help keep the urine diluted and less likely to form blockages. Lastly, certain dietary changes may also be beneficial. For instance, reducing the intake of foods high in calcium and oxalate, such as spinach, rhubarb, and beetroot, can help prevent the formation of bladder stones, which can cause blockages. By implementing these steps, we can prevent and manage catheter blockages effectively. So remember, regular maintenance, immediate action when a blockage is suspected, and appropriate dietary and fluid intake can all contribute to the successful prevention and management of catheter blockages. Another common problem with urethral catheters is catheter-associated urinary tract infections, also known as CAUTIs. These infections are a significant concern in healthcare due to their high prevalence and potential complications. But what exactly causes a CAUTI? This is largely due to bacteria entering the urinary tract through the catheter, leading to an infection. The most common culprits are bacteria like Escherichia coli, or E. coli, and Staphylococcus saprophyticus. These bacteria can climb up the outside of the catheter or ascend through the catheter's lumen, eventually reaching the bladder. Once in the bladder, these bacteria can multiply and cause an infection. Now, how do we know if a patient has a CAUTI? Symptoms can vary, but common ones include fever, lower abdominal pain, and changes in urine such as unusual color or foul smell. It's also worth noting that some patients, particularly those who are older or have weakened immune systems, may not exhibit these typical symptoms. Instead, they may have nonspecific symptoms like confusion or general malaise. CAUTIs can have a significant impact on patients. Aside from causing discomfort and distress, they can lead to severe complications like bloodstream infections, also known as sepsis, and damage to the kidneys. For patients already in the hospital, a CAUTI can prolong their stay, add to healthcare costs, and increase the risk of mortality. But it's not all doom and gloom. The good news is that CAUTIs are largely preventable. By adhering to good hygiene practices, using aseptic technique when inserting and managing the catheter, and only using catheters when absolutely necessary, we can significantly reduce the risk of CAUTIs. Moreover, if a CAUTI does occur, it can be effectively managed with appropriate antibiotic treatment. However, it's essential to remember that prevention is always better than cure. But fear not, there are ways to prevent and manage CAUTIs. In the next scene, we will delve into how we can solve this problem and ensure the well-being of patients with urethral catheters. Preventing CAUTIs is crucial in ensuring the well-being of the patient. A catheter-associated urinary tract infection, or CAUTI, can lead to serious complications, ranging from discomfort to sepsis, a life-threatening condition. Therefore, it's vital to understand how to prevent and treat these infections. The first step in preventing CAUTIs is to ensure that catheters are only used when absolutely necessary and removed as soon as possible. Catheters should not be used as a solution for incontinence or convenience, but only for specific medical conditions. Reducing the amount of time a catheter is in place decreases the likelihood of infection. Hygiene plays a pivotal role in prevention. Healthcare providers must wash their hands thoroughly before and after handling a catheter. This simple act can drastically reduce the risk of introducing bacteria into the urinary tract. Sterile technique is also essential during catheter insertion. This involves using a sterile catheter and sterile gloves, drapes, sponges, and an antiseptic solution for cleaning the urethral area. The use of a single-use packet of lubricant jelly for catheter insertion is also recommended. In addition, the catheter and the collection bag must be kept clean and below the level of the bladder at all times. This prevents urine from flowing back into the bladder from the tubing and collection bag, which can cause infection. Despite all preventive measures, if a CAUTI does occur, it's important to treat it promptly. Treatment often involves antibiotics to kill the bacteria causing the infection. Your healthcare provider will choose the right antibiotic based on the type of bacteria causing the infection and the patient's overall health. In certain cases, the catheter may need to be removed or changed. A new catheter can be inserted once the infection has cleared to prevent the infection from recurring. Remember, every healthcare provider has a role to play in preventing CAUTIs. From the moment of insertion to the time of removal, each step matters. With these strategies in place, the risk of CAUTIs can be significantly minimized. Let's continue to work together to reduce the prevalence of these infections and ensure the safety and well-being of all patients. Dislodgement is another issue that can arise with urethral catheters. This problem can occur in various circumstances and can lead to a host of complications, not least of which is the discomfort and distress it can cause to the patient. Catheter dislodgement can happen for several reasons. It might be due to the patient's movement, especially in cases where the patient is not fully aware of the presence of the catheter and inadvertently displaces it. In other instances, it could be a result of improper insertion or securing of the catheter. The catheter may not be well anchored and thus prone to slipping out. The implications of catheter dislodgement are manifold and can be quite serious. First and foremost, it interrupts the continuous drainage of urine, potentially leading to urinary retention. a painful condition that can also increase the risk of urinary tract infections. Moreover, frequent dislodgements can cause trauma to the urethra, leading to inflammation, bleeding, and in severe cases, strictures or narrowing of the urethra. In addition to the physical discomfort and potential medical complications, catheter dislodgement can also have psychological impacts on the patient. It can cause anxiety and distress, particularly in patients who are already dealing with the stress of illness. In cases where the patient is elderly or confused, repeated dislodgements can lead to feelings of frustration and helplessness, further exacerbating their overall health condition. It's also worth noting that catheter dislodgement can increase the workload for healthcare providers. Each time the catheter is dislodged, it needs to be reinserted, which takes time and resources. Additionally, dealing with the potential complications of dislodgement such as urinary tract infections or urethral trauma can further stretch already strained healthcare resources. However, there are methods to prevent and manage catheter dislodgement. These include proper catheter insertion and securing techniques, patient education, and the use of specialized catheter securement devices, but we'll get into those in the next segment. For now, let's remember that while catheter dislodgement is a common problem, it's one that can be anticipated and managed effectively. To prevent catheter dislodgement, consider these steps. The first measure is securing the catheter properly. This is typically done using a catheter strap or a specialized catheter securement device. These tools are designed to hold the catheter in place gently, yet firmly, reducing the risk of it getting pulled or knocked out of place. Secondly, it's essential to maintain a good hygiene regimen. This includes regular cleaning of the area around the catheter insertion site. It's also important to keep the catheter and collection bag clean and free from kinks or twists to ensure unimpeded urine flow. Thirdly, practice careful handling of the catheter and its accessories. For instance, when moving or lifting the patient, make sure the catheter isn't being pulled or strained, and always remember to keep the collection bag below bladder level to prevent backflow. Now, what if the catheter does get dislodged? Don't panic. First, clean the area with a mild antiseptic. Then, if you've been trained to do so, you can attempt to reinsert the catheter. Otherwise, seek immediate medical assistance. It's important to note that reinsertion should only be attempted by those who are comfortable and trained in the procedure to avoid causing further harm. Also, make sure to monitor the patient closely for signs of discomfort or infection. These may include fever, chills, increased discomfort in the lower abdomen or at the catheter site, or changes in urine color, consistency, or smell. If you notice any of these signs, seek medical help immediately. Lastly, remember that catheter care is a team effort. It involves the patient, caregivers, and healthcare professionals working together to ensure the best possible outcome. Regular communication and education are key to this. By staying vigilant and following these steps, catheter dislodgement can be effectively managed. Urethral catheters, while immensely beneficial, can present certain challenges. As we've embarked on this journey, we've delved into the complexities and intricacies of urethral catheters, assessing both their undeniable advantages and the hurdles they sometimes present. We've examined three main problems: catheter blockage, catheter-associated urinary tract infections, or CAUTIs, and catheter dislodgement. Each of these issues, while daunting, is not insurmountable. In fact, we've explored in detail the practical and efficient solutions to overcome these challenges, ensuring the safe and effective use of urethral catheters. Catheter blockage, the first problem we discussed, can be a significant hindrance to the smooth functioning of a catheter. However, with regular and meticulous cleaning, coupled with the use of appropriate lubricants, this issue can be addressed effectively. Next, we tackled the issue of CAUTIs, a common and potentially serious complication. We emphasized the importance of stringent hygiene practices, the use of sterile equipment, and the prompt recognition and treatment of infections to combat this issue. The third problem we discussed was catheter dislodgement, a problem that can cause discomfort and potential harm. The solution to this, as we've learned, lies in secure and correct placement of the catheter, along with regular checks to ensure its position and integrity. Throughout our discussion, a common theme has emerged: the importance of preventative measures and proper catheter care. These are not merely solutions to specific problems, but fundamental principles that should guide all interactions with urethral catheters. In conclusion, it's essential to remember that while urethral catheters can present challenges, they are indispensable tools in medical practice. With the knowledge and understanding of the common problems and their solutions, we can navigate these challenges more effectively, ensuring the safety and comfort of those who rely on these devices. By understanding these common problems and their solutions, we can ensure safer and more effective use of urethral catheters.